how do we link best practice with telepractice? You know, how can we kind of make sure that that's what's happening? So if you don't mind, Ed, taking that, as you know, because you just segued quite nicely into that question. So thank you.
Yeah, sure. I think traditionally we've looked at digital practice as an adjunct to what we do. We've looked at it as possibly an inferior product to being in person and working in person with people, and that's something we can debate at a later date. But I think what we need to realise is that the virus has put us in a position, a fantastic position as clinicians, for all the horrible things that are happening around the world at the moment. We have an opportunity to rethink how we deliver services, but also reconsider the evidence behind them. So there is a lot of evidence behind digital practice, and I believe it was about 1920 odd when the first I guess telepractice began with the RFDS and pedal radio. So we do have a long history of this stuff, and there is a big evidence base out there across a lot of allied health disciplines and the medical professions as well. But I think we need to preface that kind of the discussion about leading to best practice in digital practice by always referring back to the literature. I think we're jumping into things very quickly at the moment, as we have to, transitioning very quickly, but that doesn't mean that we don't have to look at the literature and don't have to look at what's come before us. So there is a lot of literature out there, and there are a lot of experts in this area who can support with specific service delivery models for different client groups, whether it's little kiddies, whether it's kids with disabilities, and you know, outside of this forum, I guess more less relevant here though, but adults and teenagers and aging people as well. So there is the evidence out there, but we need to look at it first before we actually dive in the deep end with this stuff. Don't rely just on your mates and consensus with your mates, because you might be in a little bubble and not getting the whole picture.
Thanks, Ed. Could I just remind people or ask people to turn off their videos, because it does actually help with the audio quality if we have less videos on. So if you can turn off your video, if you're not one of the speakers, that would be great. Seb, I might get your thoughts about how best practice and telepractice can link together. You're muted, Seb.
Thank you. Bad habit. Yeah, look, very interesting, Kim. There's been lots of talk recently around, you know, best practice over telepractice as well. So, look, as far as early childhood intervention Australia is concerned, I can say that best practice really isn't too different. So best practice in terms of face-to-face, as we know, looking at those national guidelines of best practice in early childhood intervention, for example, very much puts, you know, the family at the core and capacity building practices. So using telepractice is another model, another mode, I should say, where you'd work again with families and caregivers to upskill them, work within everyday routines, natural environments, it's in their homes, that sort of thing. So it shouldn't be too different, although perhaps it might take a little bit of transition for some people. So yeah, as far as I'm concerned, it's just another mode, but evidence-based practice and all that can continue.
Thanks, Seb. So I guess I'd just throw in a few bits there from our... Oh.
I was just going to reiterate what Seb said. I think that the opportunity that we have now is really to deliver any kind of intervention really in context, which is, you know, we have some prescriptive interventions that work for certain clinical presentations, but in a lot of cases with kids with disabilities and little kids, it's really important to deliver in context. Digital practice gives us that opportunity because, you know, people are in their home or they're in, you know, that context where this behaviour, where this routine, where this communication is taking place. And that's really important for them to be able to generalise that skill and keep building on those skills.
Thanks, Ed. Yeah. So I guess the bit that I was going to talk about from a more theoretical point of view, I suppose, but it's also practical, right? We did a small study with 4 families with a speech therapist and OT who were delivering all of their services online. And what we found was that it actually was incredibly compatible with what we would consider best practice. So this is a mode of service delivery, nothing more, nothing less, right? It's a way of getting your service to someone. Just like some people do a clinic-based service, some people do a home-based service, some do an outreach service. Telepractice or online delivery is part of that. So the one thing that did surprise us a little was that it actually really fosters coaching, which is, you know, as an OT and I think as an early intervention practitioner, coaching is recognised as a key part of good quality early intervention. And because you are in this mode and this environment, coaching is not an option. You actually have to coach. And so it really made practitioners and parents engage much more in a coaching relationship than in sometimes people found in a in-person environment, or where people might have provided services in a childcare centre and didn't necessarily connect with the parent as much, or so that it actually had the capacity to improve the implementation of coaching. So not only is it not an inferior quality, it actually could help us get towards some of those things that we aspire to around good practice in early intervention. So I might move on to the next thing, which again I think segues a little, and I might put this to you first, Seb, is about how you engage caregivers in this. How do you help caregivers see telepractice as an option that is worth going with and that can work for them?
Yeah, definitely. Thanks, Kim. So look, it's quite interesting. I think a lot of it comes down to the confidence of the practitioner themselves in video telepractice and the belief and that it can work and be quite effective. So I know at the organisation I work for at the moment, we're having discussions around trying to untangle why some therapists are able to get 100% success rate from their caseload with families engaging with telepractice, whereas others have got very few. And what we're finding is that some of the conversations that are being had is activities to do in between, that sort of thing. So I think that's a real key element. And working with families, you know, and if you are new to telepractice, that it's okay to be vulnerable in that, because they know that you have skills as an early childhood intervention professional, as a speech pathologist, OT, physio, whatever you are. You might not be expert in telepractice, but nor are they necessarily in using technology, and you can work together, keep establishing that rapport, and make some gains and get some successes, I think. So once you have a success, then move on to the next success, and don't be afraid to be there with your clients, learning some of that together.
Thanks, Seb. Would you like to add to that? But just before, I'm asking people again to turn off their videos to help us with the audio stream, so we keep our audio stream as synchronous as possible. Thanks, Ed.
Thanks, Kim. I just had, oh, sorry, there's a comment here that says there was a freeze after I spoke about what is working well. So, yeah, I'm trying to remember what that exactly was, but I think it was largely around the confidence in therapists and how they're promoting the use of telepractice and their belief in it themselves and how they are able to get families on board. Thank you. Over to you, Ed.
Thanks, Seb. I'd agree with that too. I mean, the practices that I've been coaching into digital practice lately, the biggest issue has been confidence. They've thought, can I, I'm not showing my confidence to my client, or I don't think I can actually support that intervention online or continue with that goal online because I just can't see in my head at the moment how to do it. And that obviously, your client can see that. Your client can see how confident you are about what you're doing too. So I think being really upfront and honest about being new to this kind of service delivery model is really important. That's what I found in my research too. Make sure you're walking alongside the person and tell them that you're learning as well. But I think using the person-centered approach, if you, in a very basic example of this, I guess it's not assessing first, it's creating goals first and then assessing. Instead of just going in and going, right, what's the issue? And then going, okay, this is a list of what we could work on. If we flip that around and go, how are you going? What's your family struggling with? And you might not find that out really specifically in the first session or in the first few sessions. But once you develop a rapport, once you start working on some stuff, and like Seb says, getting some wins in just that rapport building or finding out what works for a certain kid, then you can start really targeting something in context and something that's really relevant. So, your family might say, well, actually it's bedtime routines. That's what we're really struggling with. We don't want the speech articulation stuff. We're not engaging with that. We don't really see it, moving fast. We want to, get a routine in place for bedtime and go from there. And that's how I find that you get that kind of link in to the family's life, and that more trust and more success in what you're doing. And again, those in context interventions and that coaching model is just key to binding that all together.
Thanks, Ed. I guess I'd add in there, if there's sort of another component here around helping families to see how telepractice might work for them. So engaging caregivers, so family members and others perhaps, into seeing how it might work. And that's hard for all of us, right? We're all having to shift our thinking in a big way. And so I've seen with some organisations, they've got a little brochure that talks about how they've gone about approaching something, a particular area of practice, and how they've adapted it to go online. Sometimes there's a proof of concept session that people run where they talk about, well, this is how I would handle a handwriting session, or this is how I would handle whatever it might be. I'm pulling things out of thin air here, but so it's a way of working it out together, because as we know, it's co-design, it's collaboration that gets you the best outcomes for your interventions anyway, which is fundamental to good practice. So it's just that we're on a different platform now. You might have had to do exactly the same thing when you're going on a home visit, where you work out what's the right time to come, what's the right room to do it in, what's the, who else should be in the house or not. Those are the things you're negotiating when it's not online. But when it's online, it's a different set of things, but you're still negotiating that and trying to understand how that might work. Then you have a shared expectation and you'll get buy-in. Not all the time. There will be some times where you go, actually, this isn't going to work for this particular thing. So there will be times where you decide that a telepractice platform isn't going to work for this particular situation at this time. But I encourage you to think broadly, right? Don't pull that card down too early, because it's about expanding your own horizons and the family's horizons to see how you can use this platform to deliver things that are essentially about human connection and interaction that this platform allows you to do. It's not in person, in physical proximity, but it's still got a lot of relational components to it, which is at the heart of good early intervention. So there's a question that was that I've picked up from the chat box about people who are disadvantaged and being concerned that people who have less resources and access to less resources may be further disadvantaged by the current shift, I guess. And I'm guessing that the question was around that, where we've had to move to this suddenly. And I'm wondering if you might have any thoughts about that. I'll start with you, Ed.
Yeah, certainly. So this can't be applied 100% in the environment at the moment, because it does require some physical contact with people. But what UMBO does in their practice is we use a key worker model. We always have someone, and we try not to make it a family member, because we want families to be able to be just that. You know, we want parents to be parents, we want kids to be kids. We don't want them to be case managers or allied health assistants. You know, we want to be able to have someone at the other end in a community who can help with that. So in terms of trying to bridge that gap that we often see, the digital divide that can creep in with digital practice, we make sure that we build local relationships. We make sure that we're not kind of, I guess, treading on other clinicians' toes. You know, if that person has a service available that's, you know, good quality service locally, that's fantastic. We don't want to jump in there in front of them. But I can see even a few familiar names here today on the chat, who are people who are champions of their community, and who even in this context can be the link to communicate with people, the link to, you know, it might be a case of having a local service that can drop off some sort of technology or make it available to someone in an office, you know, physical distance included, you know, whether it's an iPad or some sort of tablet or something like that, that the person can be engaged in to contact the clinician. I think we need to also remember that, and this is why I call it digital practice and not telehealth, because it's about all the technology, not just videos. You can always pick up the phone, and phone calls are becoming much more accessible to people from lower SES backgrounds as well now. So even if we're not necessarily performing that, you know, specific behavioural analysis or whatever it might be in a certain intervention, right at the moment what we can be doing is performing those other things like information gathering, monitoring interventions that are already in place, or just remembering that we need to, you know, the most important thing of any kind of early childhood profession is the relationship. So building that relationship, maintaining the relationship, and that can be as simple as a phone call, a text message, which is much more accessible. But yes, that gap definitely is still there, and the more remote you get, the worse it gets. I mean, I live in central New South Wales, and it's not that remote here. You know, there's a lot more remote places in Australia, and we still have trouble with families being able to access that technology, or having someone locally who can bring it to them, who can then link with us.
Thanks, Ed. Did you want to add to that, Seb? Have we got a frozen Seb there? I might just add in a little thought there while Ed was speaking. While we're waiting for Seb there, I know that there have been some considerations by the NDIS around people being able to put technology into their plans, and trying to explore that a little more, because it's an absolute reality. So that question's really spot on, that we have to make sure that people who perhaps have low resources or access issues around technology and digital platforms don't get left behind in this situation. It's an absolute, you know, it's just a no-brainer. We have to make sure that there is something that is done about that. So there are some scope around that, but certainly in the research project that I was involved with, people did use pre-COVID, of course. Libraries, schools were quite flexible at times to have, sessions run in those early childhood centres or schools and health centres, and use the internet access there that was a bit better quality sometimes for families who lived out of town on properties, etc., and didn't have good access to reasonable bandwidth. But I also just reinforce Ed's point there around multiple modes, right? Telephones can work, email, snail mail. You can be, interacting with people in multiple ways. It doesn't all have to be video conferencing in order to provide advice, assistance, support over time. So don't get too locked into it's just about a Zoom session or a CoView or whatever platform you're using. Really think about the variety of platforms that you can use to connect with a family, to share information and knowledge and come up with solutions. So be broad in your thinking about that. Seb, how you?
Yep. Hi, Kim. I think, you went on mute for 2 seconds.
You're back now. Did you want to add anything about the resource issue?
Look, thanks. I just saw that Linda had popped up in the chat around the NDIS and how families can get devices. So, 1 day turnaround is what I know we had for one client, which was pretty amazing. But for others, I think it's a little bit trickier depending on how the plan's managed, for example. So that's a good option for children that are in the NDIS.
Great, thank you. Yeah. Now, so it's an important issue that we all need to be encouraging awareness of. It's something that we can be advocates around as well, but also guiding people to be able to get access to the resources that they may need. And when we move out of this physical distancing world, also collaborations with other agencies, as I said, libraries, schools, health services, etc. Particularly in rural and remote areas, sometimes they have a better connection. So that's worth thinking about as well. There was another question on the chat box about somebody saying, could somebody walk me through a session? Now, I'm aware of the time. We've got 6 minutes left. So could I ask you, Seb, to have a quick chat about a session, a telepractice session that you might have run? Of course, they're going to all be different, but just an example, and then we might get Ed to do that quickly as well.
Yeah, sure. So I guess personally, not working as an occupational therapist at the moment, but supporting teams. I know, I've done over video, like real practical things like supporting a parent, how to get their child to like spread their toast, that sort of thing in using a video camera. Without having done that before, I'd be like, oh, that's really interesting. But really, a lot that's gone into the sessions that staff have done are about preparing families. So giving them, some guidelines and anything that they might need for the session, letting them know beforehand. So that example which I gave around the toast then is, okay, well, let them know that they might need to move their device if they can. So that way during the session, you're not interrupting it. So a lot goes into planning, which we might not think about necessarily. Look, sessions are so varied. I know that lots of people are asking, how can you engage with a child? And, Melissa McCarthy's presentation the other week was like, well, she doesn't even have her face showing sometimes because it's more about her talking to the parent through their session. Whereas if you are, the child's curious and wanting to get them engaged, I know some therapists are like, wearing a funny hat or something to help build that initial rapport. Because although we're working with families, you still want to have, a relationship with the whole family and the child as well. So, but certainly lots of interviewing and just, if you're engaging in a coaching style, it's really not too different. So trying to have a specific session is tricky. I know on the ECIA website, we've got a small snippet of what that coaching can look like. I think it's a speech pathologist that's doing it. So I'd recommend watching that as well. But yeah, a tricky one to answer because it's also quite different.
Thanks, Seb. I'll just jump in and remind you, I was reminded as you were talking, Seb, I was talking to a colleague the other day who was recounting teaching someone how to make a pizza over a session, so an OT colleague friend, and what she was remarking on was how much more she had to coach, that she found herself going to grab something and show the kid how to do, you know, something or other, and she had to stand back and give suggestions and advice to the parent about how to do it, or problem solve it with the child as to how they might, you know, pick up the mess they'd just made or whatever it was. So it can be quite practical stuff that is done, you know, using this session, but it does take a bit of rethinking. And her comment to me was that she would never have been there at dinner time in another situation, whereas now she actually could be there at the right dinner time to be looking at that child being engaged, because the child's a fussy eater. So the idea was to get them engaged in making the food, so then they're more likely to eat it. And so, you know, that was a really relevant response to this situation. Ed?
Probably my go-to example when I'm asked this, and you know, as you mentioned, Kim, how long is a piece of string? What does an online therapy session or a digital practice session look like? Anything. But my favourite example is a young fella. He was, I think he was about 8 or 9 or 10 when we were doing this. And what we wanted to do was to coach his supporters in intensive interaction. And that's basically, in short, it's a way of interacting with people that helps them to engage more with people outside of themselves, rather than quite inward kind of stimulating behaviours that happens a lot in autism. So what we needed to do was a little bit of a blended session. So I sent them through some information about what intensive interaction was, a couple of YouTube videos that they could watch at their leisure, a little PDF that had, you know, very basic stuff, you know, a few, maybe 3 or 4 steps, you know, this is some of the things that intensive interaction looks like and how you do it. Then we came together and did probably what is a little bit more traditional in digital practice, in that we spoke together via video and we had a conversation about what they gleaned from that, and then I kind of filled in the gaps for them. Then what we did is, and this is one of the fantastic things about digital practice, is that I didn't know this child very well. So if I were in the classroom, then when I did, on the 2 occasions that I did visit in person, he behaved very differently than he would have usually, and very differently than he did when I saw him on video, because he didn't know I was there. So what I got these 2 teachers in this case to do in the classroom setting was, one had an iPad with some earphones in, nothing special, just, you know, the basic, you know, the ones you get with your iPad or your phone. And they followed this other teacher around while they tried the technique, and then I could relay feedback through that person with the iPad, follow them around and say, get so-and-so to try this, or that's good, keep doing that. And we could kind of shape that behaviour and try different parts of that technique via distance, and it worked really well. And what we get out of that as well, I guess, that we haven't said too much about coaching yet, is the fact that can then be used with other kids. These were teachers who were working in a school where there were kids with some similar needs as this little fella, and they ended up using this technique with a few other kids as well. And all of a sudden, all these kids were out of their shell and engaging with other people rather than just with themselves. So if you can upskill the person at the other end through a coaching model, that's really beneficial too. So that's one example of how I would work online.
Thanks, Ed. Now, while you were talking, Ed, my alarm has just gone off telling me that I have to wind up the session, because we have to all go back to the main room to hear the keynote. But thank you to both of you for being part of this question and answer session. There were quite a few questions that we didn't get to that had been submitted earlier and things, but then some of them covered a number of issues. One that we didn't get to was around how to manage screen fatigue And I think we're all experiencing that. So, you know, maybe we might need to just have a share on that at another time. But one of my little quick tips is I have a standing desk option, and that seems to help me because I can turn my camera off and move around a bit while I'm in meetings, or, you know, at times, you know, when we're trying to do things in, you know, multiple zones. But it's a real issue, and it's quite draining. I get it. So look, thank you everyone. I really appreciate both the speakers. So if you could give them a little bit of a clap through your reactions buttons down the bottom. So thank you to Seb, and then another thank you to Ed. And then I encourage you to go back to the main session. You've got the original link that you had, so you close down this session and then go back to the main summit session. Thank you very much, everybody.